And welcome everyone to Nutrition Science Bites. This week I'm talking to Dr. Rebecca Collins. And before you even think about it, no, she is not my daughter. I have actually known Rebecca since she was 2 years old, actually, but she's not my daughter. We get asked that all the time. So this Dr. Rebecca Collins is a lecturer in nutrition and dietetics at the University of Newcastle, and you have a big research area in ADHD. Welcome, Beck.
Thanks. Good morning, Claire. Thanks so much for having me today.
I really wanted to talk to you about this topic because I know you're doing research in the area, but I think it's a little bit unclear in terms of the relationship between nutrition and ADHD. But
Mm.
before you dive into that, can you just explain to us, please, what is ADHD?
Yeah, for sure. ADHD, or attention deficit hyperactivity disorder, is a neurodevelopmental condition. So it can present with different characteristics, different traits that are usually characterized by, inattentiveness, hyperactivity, impulsivity, and there's lots of other traits that come in underneath that as well. So you can present with some of them, you can present with just one or a couple of them. So when people are diagnosed with ADHD, they get classified a presentation. So there's three different presentations. So there's inattentive presentation, there's hyperactive impulsive presentation, or there's what's called a combined presentation, where someone might present with an even number of inattentive symptoms and hyperactive impulsive symptoms, and so then they'll be diagnosed with combined type. And so it's quite a complex procedure.
It also sounds to me, Beck, like to have that as a diagnosis, that's pretty exhausting, especially if, some periods of time you're hyperactive and then inattentive. Is this a condition then that people see? Because, I can think of people I know who, are super, super busy, or, you tend to think of little kids staring out the window at school in terms of being inattentive. So how does it kind of manifest? Like, how would someone even go, oh, I wonder if that's actually me?
It is quite hard, and that's why the diagnostic process is so complex, because people can have fluctuations of their traits across the lifetime. Some people their traits may not present fully until they're a little bit older. In general, most traits will present before the age of 12,
Right.
but it is something that, especially working in the area, you do hear a lot. You hear people go, oh, that's not ADHD. Everyone does that. Or, everyone's a little bit ADHD. So there's no one trait that
Right.
defines ADHD. So anybody can have these traits, but it comes back to the impact of someone's life.
So in that case, then, how is it actually diagnosed? Because I'm sure some people are listening and you describe those symptoms. I'm sure some people are going, oh, I wonder if that's me. And
Mm.
can you tell us how it's diagnosed? And then I'm kind of thinking, like, because I don't know anything about ADHD, is it a condition of childhood? Like, should someone, if they have it, they should have already been diagnosed by that age of 12?
Yes. So it's a lifelong condition. So
Right.
people will have fluctuations, and they will have times in their life where they think, oh, I'm actually coping really well. Maybe I don't have ADHD, but then other things crop up and it comes back. So the diagnostic process is long, and it's different for children and for adults. So for children who are being diagnosed, usually it's flagged by a parent or a teacher. The teachers often see it quite clearly in the classroom. And then the children will often be observed, but then a screening process will take place. So the parents will complete a screener, or a guardian, and a teacher will complete a screener. And then it's determined whether it looks like, yes, there's a lot of traits there, and then they progress to seeing a pediatrician, who will then go through the full diagnostic process, which is it's a clinical interview that is quite extensive. And for children, the interview will involve the child being in the room and the parents or guardians being in the room, and all of the different areas of their life that it might be impacting are discussed. So usually with ADHD, it has to impact more than one part of your life, mostly. So for children, schooling; for adults, work; and relationships is a big one as well that ADHD can impact. So for children, their peer-to-peer relationships, and for adults, more intimate personal relationships can be impacted too.
So when you say peer to peer, you know, schoolyards can be complex places, can't they? So does that mean the child's less likely to have friends, or does it mean they're more likely to have a lot of different friends? Does it mean they're more likely to be bullied? Like what are those sort of telltale things that a child might come home from school and mention, and and as a parent or guardian, you might go, oh, hang on a minute, that might be something I need to really drill down what's happening there.
Yeah, again, it can be so complex because children and adults will have different presentations of ADHD, and so
Right.
their presentation type can impact their relationships differently. So for the children that are more hyperactive, impulsive, their peer-to-peer relationships can often be challenging because they're seen as, they talk too much, they're overbearing, they try to control what's happening, whereas the inattentive presentation type children can be a bit more distracted and are seen as not being interested in their friends because their head is somewhere else all the time.
Right.
And so it can be really hard for parents to sort of determine what's going on here. Why is my child struggling with their friendships? Because it may not be clear in one way or another.
Starting to see from as you're talking, why it takes so long to diagnose then as well. And you mentioned that for children, the pediatrician will be the one who's sort of leading that diagnosis, but adults don't see pediatricians. So,
Nope.
but you mentioned it can be diagnosed in adulthood. So,
Mm.
how would an adult find out? And how would they know? Or is it about those patterns that you were describing?
Yeah, so it is about the patterns. And so most children will be diagnosed through pediatrician. There are now some psychologists that diagnose as well. There can be child psychiatrists um, as another pathway. Pediatrician is just the most common. But for adults, so adults can be diagnosed by clinical psychology or psychiatrists at the moment as well. And for adults, it's usually a couple of years of self-exploration usually comes
Right.
as I'm noticing all these things about myself. You might hear someone else talk about it and go, oh, that aligns a lot with my life. So adults will usually go and do their own screeners and
Yeah.
have a look at their own results out of that, and then we'll initiate going to see a GP to talk to a GP about getting a referral to a psychiatrist. Or if you don't want to go down the referral path, you can just go and see a clinical psych for diagnosis. And the clinical psychs and the psychiatrists will both do an extensive clinical interview with the adult as well. And then what comes after that is they have to interview someone who knew you when you were younger, who
Gosh.
knows your if it was presenting before the age of 12. So that'll often be a parent or another relative. You could have siblings as well. For people who have a challenge with that, sometimes you can just bring someone along who they can interview, who just knows you really well and can
Yeah.
confirm that the
Yeah.
traits that you're describing that are impacting your life are there. And the reason they initiate with all the screeners and then the clinical interview and then the interview with someone who knows you is so they can get the diagnosis right. And because there's some overlapping symptoms between ADHD and some other conditions, so they need to be able to differentiate between those and ensure that ADHD is the correct diagnosis.
Makes sense. Now I have a million more questions, but I think, is there like a website that we could put a link to in the show notes where people could get more information?
So the probably the best website for general ADHD and the diagnostic process would be the Australasian ADHD Professionals Association, which is ADPA, and they're the ones who have produced the clinical guidelines for diagnosis for ADHD. They have prescribing guidelines for the medications, and they have a lot of fact sheets just around
Oh, great.
understanding ADHD and things to pass on to teachers and family members to help with understanding.
That's wonderful, and we're definitely going to put that link in the show notes. So how common is it? And now I realize I need to ask you about how common is it then in like primary school age children, but then how common is it in adults now that, from what you've said, maybe not everybody has been diagnosed in childhood?
Yeah, again, so many complex questions.
Mhm.
So the in Australia, there's not thorough prevalence data. So
Right.
most of the Australian data is based on international numbers. There was a study undertaken a couple of years ago where they kind of pooled all the research that's been done for and applied it to Australia. So internationally, the overall prevalence for all ages is between 2 and 5%. And when they looked at that from the Australian perspective, they landed at around I think it was 3.2% of Australians will have ADHD. The prevalence is higher in children. It tends to sit more up in that 5% range, and with adults, it tends to sit lower,
Right.
around that 2% range because of the differences that have happened over the years in adults not being diagnosed as children, and especially women not being
Okay.
diagnosed.
That's super interesting that women aren't as diagnosed. But I just did a rough calculation in my head, and if it's around 5% in Australia, that's roughly one child in a school class, if there's around 25-ish kids. So that means you could have none, or maybe you have two, like if you average it across the school. But I'm not going to let that little fact you just dropped out there. You said women may be less likely to be diagnosed. Why is that? Why is it? Is that just because we are, as women, do a lot of things, or is it something about the way women, interact with people that it gets missed?
Yeah, there's lots of discussion and research in
It's
this area going along because it's always been reported in the literature that ADHD is more prevalent in boys than in girls. And now that they understand ADHD more and that it presents in so many different ways, a lot of little girls were missed because girls are more likely to present as inattentive than hyperactive. And girls, just on a social perspective of it, girls are conditioned a lot more from a young age to sit in your chair, behave,
yeah,
don't talk too loudly, all of those types of things. So for myself, so I was diagnosed with ADHD at the age of 40, and I was that child in school. I wouldn't get out of my chair because I didn't want to get in trouble. I
yeah.
didn't want to, say the jokes too loudly because I didn't want to get in trouble. And so you're conditioned in a particular way to act a certain way, and there is discussions that little boys are allowed to be themselves a bit more and roll around on the floor and be a little bit silly in class, and that's kind of that gender stereotyping. And girls, as they progress through high school and into womanhood, tend to put more structures in place to cope and have some better scaffolding systems than it seems that boys and men do, and are expected to be a little bit more independent at a younger age than
Right.
boys are. And so it's been commonly missed just because of how society can view girls and women.
It's just so, so interesting, isn't it? And you can imagine why, when you explain it that way, why it's more likely to get missed in little girls in particular, because you got that class of 25, 30 kids. You're actually probably more likely to have your attention drawn to the kids who are super busy and noisy than those
Mm,
quiet people in the room. So Beck, but I think we should make sure the listeners are aware, you're Dr. Rebecca Collins, lecturer in nutrition and dietetics with a PhD at the University of Newcastle. So if you're diagnosed as ADHD, look how successful you are.
mm,
So people still achieve, even if your diagnosis is not made till later. And because you do research in this area, can you tell me, how did you come to think about nutrition and ADHD? I mean, I think the only thing I've ever heard about nutrition is in relation to children, and whether, like when I graduated 40 years ago, it was all about the fine gold diet and not giving kids any bright colored things. So how
mm.
did you come to make nutrition and ADHD something that you wanted to research?
Yeah, I think it was a logical journey once I saw it as a big picture. Once I realized that, yes, I had ADHD and I could look at how I ate and how other people in my life who have ADHD, how they eat as well. And when I started to look at the research, I noticed that a lot of the research in nutrition and ADHD was that perspective that you were talking about. Almost that, how can we fix this problem with food? And
Right.
when I started to look further into it, I mainly look at adult ADHD, but there's a lot of studies out there in kids and nutrition and ADHD, and it is all about, cutting out the colors, cutting out the preservatives, reducing the processed foods. And all they've ever been able to find in that area is a really small subset of children who do benefit from reductions in additives, preservatives, colors. But it's not across the board. They've never been able to find that everyone with ADHD benefits from this type of eating. And then all of the other research I was able to find looked at deficiencies. So adults and children with ADHD are more likely to be deficient in magnesium, in zinc, in iron, in vitamin D, and omega-3s as well. And so a lot of the intervention studies are about supplementing these nutrients in diets of people with ADHD. But when I started to read all of that, I took a step back and I thought, we we don't know how people with ADHD are eating in the first place. And we know that they have all of these traits: lack of planning, lack of organization, struggle with time management, struggle with overwhelm, and all of those aspects go into eating.
Yeah.
And so I thought, okay, if I'm going to research in this area, I need to go right back to the beginning and have a look at what are the eating patterns of adults with ADHD? What do their diets actually look like? What's their diet quality? What's their whole diet? And then talking to adults with ADHD about what barriers and facilitators they have to manage their eating.
And I have an absolute burning question for you. Because when you said, so, and congratulations on doing that. And when you just describe, you're right, all the planning and everything. And if you're struggling with panic, that you said at the beginning of that discussion that when you looked at how you ate compared to other people, and I reckon everyone listening is going, what's different? What did you notice? What was different about what you're observing about your eating patterns compared to other people that you went, okay, I'm going right back to the start to look at this thoroughly from the beginning?
Yeah, and as a dietitian, it was quite a confronting question for me, Claire, to step back and
Yeah.
admit that I really struggle with healthy eating and that I struggle with ensuring that I'm eating a high quality diet because, and now I have a joke with my students that I work with in our nutrition
Yeah.
telehealth clinic at the university that I can diagnose someone with ADHD just by looking at their usual dietary intake.
So you do a
Because you'll
peek in their lunchbox and you can, well, that's going to save a lot of time on diagnosis, then, isn't it? If
yeah,
you
I
just
go,
go,
this
show me your
person
lunchbox.
probably has ADHD because there's
So
certain
tell us
things.
what are these clues?
Yeah. So there's different presentations. So it's not a 100% science so usually breakfast will be two types. There'll be the people who skip breakfast because often medication suppresses appetite. Some of the medications are taken quite early in the morning, but there'll be the other pattern of ADHD eating, which there'll be one or two breakfast options, and that's it. That's all they'll eat, and that's me. I eat Vegemite on toast every single morning because I get up and I know that's just what I'm going to have because thinking about other options is too difficult. Um, Adults, especially with ADHD, will be lunch skippers or lunch non-planners. So we'll often buy their lunch at work, or we'll
Right.
have something more like a snack for lunch because the idea of making a sandwich, preparing some sort of salad or meal for lunch is too much forethought. It's too much pre-planning. Unless you've got leftovers from the night before, lunch probably isn't happening. And then you'll see dinners, and they'll be really those simple, quick to put together, sometimes convenience foods type dinners. So Mexican dishes, really common, pasta dishes, stir fries. There won't be anything that's changing too regularly. There'll be some staples in there, and they'll be simple, and they'll know what they're heading for.
So would you say they're not getting out the, MasterChef style cookbooks and cooking up a storm a few times a week,
That rarely
right?
happens unless you're somebody with ADHD who you may have heard of ADHD hyperfocuses, where people have a particular area of interest.
All right.
So when I come across someone who food is their hyperfocus and their interest in cooking, they have
Yeah.
fabulous meals. That's what they
Right.
put their energy into. They're happy to do all the planning and organization because that's what they love.
It's so interesting, Beck. I never would have sort of thought about that as a way of a manifestation of ADHD. So I think you're going to discover some really interesting thing. And is this what you're doing your research on now? Because I know you're actually recruiting for a study. So
Mhm.
can you tell us about that, just in case some of the listeners going, "Oh, that sounds like me," or they know somebody who might want to participate?
Yeah, so we're currently recruiting for a study looking at whole dietary intake of adults with ADHD. So we've done some previous work. So we've got a study on the diet quality of adults with ADHD, which has been interesting. The results are getting written up at the moment, and because adults with ADHD are continuously receiving the message of people with ADHD follow unhealthy diets. That's what all the dietary pattern studies say. But we're looking at the results at the moment in diet quality of adults, Australian adults with ADHD, and their diet quality is the same as the general population of Australia,
Uh,
which,
Is
we've got
that
big numbers with that, Claire.
So is that, and because Australians are just so amazing, or have you already thought about, or is that because diet quality in Australia? And when we talk about diet quality, we mean the nutritional quality, so like the healthiness, or is that when you say it's the same, is that because actually as Australians we're all not that great in terms of diet quality?
I would unfortunately say we're all not that great, but we were
Yeah,
actually quite happy with these results of this study because it's saying,
yeah,
you know what, even if you have ADHD, you're doing the
yeah,
same as the rest of
yeah.
Australia.
Well,
And
that is positive. That's good news
yeah,
at least. You don't have to stress about that. But what else are you doing then?
yeah. So that then led us into going, okay, well, let's look at whole diet. And so at the moment, we're recruiting Australian adults who have been diagnosed with ADHD, and we're getting them to undertake the Australian Eating Survey so that we can look at everything that they're eating in the last 3 to 6 months. And people all receive the dietary report instantly from that so
So
they can have a look.
they'll get a personalized report on their food and
Yep.
their nutrient intakes.
Yes. So we did we did a lot of pre-work putting this study together because, again, inattentiveness, distraction is a big thing for people with ADHD. And as you know, Claire, the Australian Eating Survey is quite a lot of questions.
Yes,
So we prepare people for that. We have a lot of information in there about why we're collecting the information, why it's important, that it is a long survey, but we have structures in place so that if you need to save it and come back another time, we'll get in touch with you and make it really easy for you to jump
you
back
can
in
do that. So
and
people
keep
don't
going.
need to stress. You're saying if they might really like to have a personalized dietary report and fill in the questionnaire, but if that's too hard or too distracting, then they can just save the place and come back. So, how do people then find out about participating in the survey? We can definitely put something in the show notes, but you tell me what we need to put in the show notes so people can find out about the study.
Yeah, so I've sent the flyer through, which has the QR code and the link to be able to commence the survey. If anyone has any questions, they can email us at adhd-project@newcastle.edu.au and we can send you out the link from there to commence the study. And we're looking for 250 adults, and we've only just started, so lots of places still left to be able to have a go at this one and get your personalised dietary report and be able to contribute to that knowledge gap of what Australian adults with ADHD are eating.
I've got another question. So people will fill in this survey, and how long will it take them to do the survey,
It should take about
roughly?
20 to 25 minutes.
Okay. And then we'll put the email address that you just gave in case they also have a question after they read the information sheet. But will they be able to find out something collectively once you've enrolled everyone and then been able to analyze the results? Will they get an information sheet or something back down the track once you complete all the analysis and write it up?
Yeah, so we've ensured that that can happen because with the Australian Eating Survey, you create a profile. So we're collecting email addresses, and once we're able to analyze the results and get some data together, we'll be able to send that out to people just to let them know what the results were and future directions as well, which we have lots of big plans for in that area.
Yeah. So, Beck, before I ask you about the recipe that you're going to provide us for No Money, No Time, is there anything else that you'd like people, and especially adults living with ADHD, to know? Or are there any things that you feel they, if they knew right now, might help them, especially in regard to nutrition?
Definitely. So I think one of the main things for people living with ADHD to remember is that the world and the dietary guidelines and recommendations were not designed with an ADHD brain in mind, and that there's a lot of messaging out there around not eating convenience foods, cooking everything from scratch, sustainability that can be really tricky for people with ADHD to navigate because for people with ADHD, buying a bag of cut up carrots can hugely increase their vegetable intake. Whereas the
Yeah.
messaging is don't buy the bag of cut up carrots because that's extra rubbish and just cut your own carrots. But if it means that you're not going to eat vegetables because you're having to cut them up all the time compared to buying them pre cut, that can be
Yeah.
such a huge difference. So, my message to people with ADHD is always be a bit easy on yourself. If it means the difference between eating something and eating nothing, then choose the food that is going to ensure that you're eating something. And to know that our research team is working on coming at it from that perspective of how do we support adults with ADHD to eat in a neuroaffirming way that might look a little bit different to what the rest of the Australian population is being told, but it's going to ensure that we can help support their diet overall.
I think that's really good advice, Beck. And I really like the way you said that. Like, if it's a shortcut and it improves your nutrition, then it's definitely worth taking because the alternative is your nutrition's going to be worse.
Mm.
Now, can you tell me about the recipe that you've given us? And we'll put it in on No Money, No Time and do the analysis, and we'll include that in when we promote it on No Money, No Time as well, the link to your recipe.
Yeah, so mine's a bit of a nostalgic family favorite in our Collins family. So many years ago, my sister loves cooking. She's the opposite to me. And she went through all mum's 1980s cookbooks one time and found this microwave cookbook. And there was this mince dish in there that I think she would have been early teens or something like that when she discovered this. And it's so simple and it's just beef mince, onion, garlic, tomato paste, capsicum. You can use sour cream, but you can replace that with Greek yogurt and put that in there. And then a little bit of cheese. And it is designed to be cooked in the microwave, but we just cook
Yep.
it in. It's gone through modifications. We cook it in a frying pan most nights. We change the cheeses in and out for whatever you've got in the fridge at the time. You can pick and choose. And then we just have it with like some veggies or salad on the side. And it's so quick. And it's one of those dishes that we've spread to other families. And everyone calls it Manda's mince. So my sister's
Right.
name is
Okay.
Amanda, so it's known amongst families as Manda's mince. And in our house, if we're cooking it, the kids come out, emerge from their bedrooms and
All
smell and
right.
go, "Oh, it's mince dish night." So it's always a hit. We don't have many people who turn that one down.
That sounds like a perfect recipe for no money, no time. I like the fact that it's really fast. So thanks for your time today, Rebecca. And I wish you all the best for your research. And I'm sure lots of people listening, if they don't have ADHD themselves, likely know someone so can help spread the word about the study that you're trying to get those 250 adults in. So thanks for being on No Money, No Time on the Nutrition Science podcast today.
No worries. Thank you so much for having me.